Hey guys, Nurse Chris B here. I just wanted to come on very quickly while I had this thought. I am leaving a client's home. She had breast augmentation maybe about 2-3 weeks ago, and she's used up the hours in her package, right? She has gone back to see her provider. She's had her post-op visit with her surgeon. Okay, her daughter or niece, anyway, somebody in her household is a CNA. Okay, so she sent me a text last night saying, she didn't feel like she felt like something was wrong, something was off. She meaning the client. She just felt like something was off. She couldn't she couldn't just figure it out, but if I would be willing just to come back and just assess her and everything. And I'm like, yeah, sure, like no problem, right? So came back, pleasant family. The CNA family member is here, and when I walked in, the CNA family member was like, okay, yeah, like I took her vitals, it's this, it's that. She's complaining of yada yada yada. Like she legit gave me a full report, right? Like as if we were in a hospital setting. Okay. So just when people have major surgery, you're going to have swelling, you're going to be uncomfortable, you're going to have pain afterwards, but this client just wanted to be sure there's nothing wrong with her, right? So I say that to say, in this business, sometimes we'll be like friends and family members. They just may kind of get in the way. They don't know what they're doing. You have that. Or they just won't do anything, right? They're like, oh my God, what do I do? I'm not gonna do anything. Like, do something, right? But in this particular case, the respect between the medical professionals, right? The respect of the CNA of, this is a nurse, let me give my report to the nurse, okay? And the respect back from me to the CNA. Nope, she doesn't work for me. She didn't have to do all that. She didn't have to tell me anything, right? And I know sometimes as professionals, we don't like to tell other people, especially when we are going into a medical setting ourselves, oh, I'm a nurse, I'm that. I don't do that, because I'm like, yo, you do your job and you assess me without bias, right? Or don't give me extra treatment because I'm a part of the medical field. Just do your job, right? So I'm saying that to say, sometimes friends, family members will be a second set of eyes, second set of ears for us, and help us, okay, and assist us. So as I said, there's nothing perfectly wrong with this client, and I believe I want to say it's her niece, and her niece was like, I told her that, but she wanted to hear it from the nurse, right? And I understand that. And I reassured the patient. I said, hey, you have an experienced medical professional here with you, because in the state of North Carolina, right, CNAs, they can take vitals, they know the parameters to look for, and if something is wrong, they report it to the nurse, right? These ladies' vitals and symptoms, they were all within normal limits. But still, the client was like, I don't feel something is right. I feel like something else is wrong. I need a second set of eyes. Okay. So it was just a good interaction. Nobody felt that we were stepping on anybody else's toes. We worked well together. I'm probably never going to see that CNA again. And on top of that, the client was like, okay, can I pay you for for your time? No, you don't have to pay me for your time. because you just pay, you don't have to pay me for your time, because I don't nickel and dime my clients. I'm not going to charge you for an hour when you just paid me a nice chunk of cash, right? So it's little things like that as well, providing these extra tidbits, because I also know that client gonna have surgery again, and guess who she gonna call? She gonna call me. Okay, so I just wanted to share that little experience with you guys. Don't be afraid to use the family members. Have a good rapport with them. When you're talking to them, see if they have plans for other surgeries, because if they do, just do little things that will make the experience of having you as their provider worth it. All right, Nurse Crispy. Oh, I'm promoting my school community, SKOOL, helping nurse entrepreneurs build their own practices. I'm going to put the link in the description. Come and join me. The first 10 nurses, you have free lifetime access. You're going to be the core to help me build up the community until the official pre-launch in September. All right? Look forward to seeing you on the inside.